is a byproduct of your blood, guys. Don't think it goes in different routes. It's the same. It's your blood. You filter it into urine. And what make this happen is certain structures called nephron. I have a big picture of a model for a nephron. Make sure to know it. It's in there. That's going to be on the final as well. They magnify it for you, showing you the glomerulus, the Bowman's capsule, all the tubules, because all the filtrate is going to pass it through those structures and becomes urine. Okay, so we start with the kidneys, down to ureters, bladder, urethra. So the kidneys can have a good function, which is maintains homeostasis, because you don't want to keep excess fluid in your system, because you're going to go to overhydration, and overhydration can kill us. Why? Because it dilutes the sodium and causes what's the term? Natremia. Remember, we talked about it. If sodium drops because you overhydrate yourself, dilute your plasma, that's going to bring the potassium up. And hyperkalemia can kill you because it can affect your heart and causes arrhythmia and also affect the kidneys, hyperkalemia. So we have to be careful of overhydration. So maintaining homeostasis is good by managing the volume and composition of fluid reservoir. And don't forget, we have also some of the functions that I'm going to mention, including the hormones and other things which is coming. But here is what you can see. And this is, you can see it also on the torso model. You'll be able to see also this when we dissect the fetal pig, because we're going to go over urinary system and reproductive system, digestive system, all the systems, you're going to see them. We're not going to deal with the muscles except the diaphragm. So you're going to see the diaphragm because you're going to open chest cavity, abdominal cavity, and that's the divider between both. So definitely you're going to see diaphragm. But again, why do you think the right kidney at lower level? Can you see here a right kidney at lower level compared to the left kidney? Because of what? Liver, exactly. Liver on the right hand side, push the right kidney down about half length of a vertebra. I'm not going to say full vertebra, no. Well, about half length of a vertebra down here. And we can see the aorta. That's the abdominal aorta, because when it leaves the diaphragm, we're going to change the name into abdominal. It was before what we call the aorta, thoracic. And then abdominal aorta, and be careful with the paired, unpaired branches for final, okay? And we can see them here and here, see? That's a celiac trunk, give me the three, one to the stomach, called gastric artery, and one to the liver called common hepatic artery, and one to the spleen. Remember the three structures here? Splenic artery. All of those came from the celiac trunk, and then you have superior mesenteric and inferior mesenteric. See, superior and inferior. And we have, remember the paired branches, lumbar arteries, and two common iliac. That's where the aorta divided into, like inverted Y shape, you see it? So the two common iliac, and the common iliac give me what? External iliac and internal iliac, and the external iliac continue as femoral, the one I'm pointing to, okay? Because it passed the inguinal ligament. So this is kind of like a review, guys, because I want to help you with the final. When I point to those, make sure to know them. It's always on the final. Paired, unpaired branches of the aorta. There is one coming from the back, you're not seeing it here. Anyone remember?
The what?
I know we're not seeing it. Did I add it to you, this one? Okay. We've seen paired branches here, correct? That's one and that's one. There are lumbar branches coming here. We call them lumbar arteries. Also, those are branches of the aorta. okay? And we have one coming from back and run on the sacrum, way far. I don't know if I include it or not. Dorsal sacral artery, did I mention?
Yeah, I think you did mention it.
We mentioned that,
Yeah.
okay. That's also required as unpaired branch, but it originates from the back of the aorta, not from the front, from the back, and runs over the sacrum. Okay. The kidneys, they have the glands on top of them. You call them suprarenal, it's okay. You call them adrenal, it's also okay. And the gland has cortex and medulla. And we talked about the cortex. You saw a slide, correct? Of the adrenal gland, cortex and medulla, and the GFR, remember? And we're going to talk about GFR here, but as another term, which is glomerular filtration rate. Yeah. Some of the functions, you know that the kidney can reabsorb sodium if your body needs it through the renal tubules in the nephrons, or it can expel excess sodium. So you eat pickles, you don't need them. You don't need the sodium. So kidney will help you expelling that sodium. And there are certain cells, I'm going to talk about them, called principal cells that deal with that. But wait until we get to those cells. And there are certain cells that deals with the H ions. If you like to write them on the side, cells that deal with H ions and HCO3 ions. Like if you have excess H ions, they can dump it. If you have less H ions, they can what? Trap it. You see? We call them intercalated cells. All right? And we have cells that deal with the sodium. Okay? And what hormone can affect those cells? Based on your understanding from endocrine system. So those cells, we call them principal cells. They're in the distal duct. And those actually, they respond to which hormone? Aldosterone, very good. So they can retain the sodium, okay? And, or if your body doesn't need it, they can what? Dump it in the urine. So two major cells. One important for homeostasis of acid-base balance by either retaining H ions or dumping H ions, retaining bicarbonate ions or dumping bicarbonate ions, and those cells called intercalated cells. Other cells in renal tubules, we call them principal cells. They're important in regulating the sodium, either keep it, reabsorb it, or secrete it, means dumping it in the urine. And that's how we keep your pH of the blood all the time from 7.35 to 7.45. See, those cells are very important. Homeostasis. Regulation of blood volume, of course, can come from what? What hormone that you learned in endocrine? ADH, anti-diuretic hormone. From which gland? Pituitary gland. What lobe? Posterior lobe, correct. So right next to everyone that we mentioned here. The last one, regulation of blood pressure. Who can tell me through what? But that's from the heart. I'm talking about the kidney. And we talked about it.
EPO?
EPO has something to do with the bone marrow. Renin.
Oh, renin.
So right next to the last one, renin. So I want you to go back and look at it. So renin convert angiotensinogen into angiotensin 1. And I said RAS system is important. It's gonna hunt you in every single chapter. Believe me, it's coming all the time. We talk about renal. Maintenance of blood osmolarity also, that's true. Because if I reabsorb water back to my blood, I can keep the osmolarity of the blood in constant and normal range all the time. We don't want thick blood. So let's get some of the water back to your system from the kidney tubules. And now the water in the plasma will stay in normal range. So osmolarity of the blood also is important. What else can contribute to osmolarity from those? From this page? Sodium and potassium, exactly, electrolytes. Electrolytes, guys, are the basic ions for osmolarity. Okay. For example, if you want to understand osmolarity, you have a glass of water, okay? Then another glass of water, you start putting salt in it. Which one has high osmolarity in this case? It's the one you added salt, okay? Because the amount of solute, which is the particles of salt, is higher, correct, than the water content. So that means the osmolarity becomes higher. Now, to keep the osmolarity of the blood always in good shape, I have to absorb optimum amount of sodium back through renal tubule, or maybe dump it. Suppose you ate pickles at that day, you're not gonna keep it. So which cells will be able to do that? Are you guys awake?
No. The principal cells?
Principal cells, correct? So we just talked about it. So principal cells are the one gonna do that, and they are lining your distal convoluted tubes. Okay. Another example I can give you. Okay, let's say I have a breathing difficulty. I am not breathing out CO2 that accumulated in my blood, okay? And now I have increased PCO2, okay? And that's gonna mean acidosis, correct? We talked about acidosis, alkalosis, and I showed you that line, and I said this is important for the TEAS exam, because they're gonna ask you those questions. Now, when you have acidosis, you're gonna have high amount of H ions. Now, which cells in the kidney can respond and help me in this case and dump excess of that ions?
The intercalated cell.
Exactly, intercalated. So we understood how they work? Yeah. So keep your body in homeostasis all the time. Calcitriol, I mentioned it in the previous, and I told you this was calcidiol from the liver taken by the kidney. Kidneys will actually convert it into calcitriol, and this helps you absorb calcium from your intestine. It's a hormone-like, and then released in the system, in the blood, and target the absorption of calcium from your intestine and from the renal tubule. So we get that calcium back into our blood. So it's very important for us. So that also we shouldn't ignore. Don't forget to add renin. I don't know why we missed that, but add here and renin. And we just talked about renin. And EPO, erythropoietin, we talked about it before. Target cells will be the hemocytoblast in the bone marrow to produce all blood cells, red blood cells, white blood cells, and platelets. And also we talked about this. So if your kidneys are suffering, for example, you have bilateral kidney failure, you have to be on hemodialysis machine. Okay? We have to clean up your blood from waste because you don't have kidneys to do it. That's the concept of hemodialysis. Now, what else they can develop? Remember, they don't have kidneys, they don't have what? EPO. So what they can develop? Anemia. And this type of anemia called renal anemia. Now, are we gonna leave them living with that condition? No. The good thing, we have synthetic EPO. Companies managed to manufacture it, and they call it E-potent alpha. So you give it under the skin. Yeah. Nurses usually, they give them the injection, and if you work in hemodialysis unit, they tell you give this under the skin, like the insulin. So you give them E-potent alpha because they're not making what? Erythropoietin. They don't have kidneys. So you're gonna minimize the possibility of what? Anemia. That's one of the key. Also, the kidneys regulate the blood sugar level. How? Now, if I check your urine, and I'm assuming all of you are non-diabetic, you don't have diabetes. If I check your urine, can I see a little bit of sugar in your urine? Probably yes.
Yes.
Nil. Zero. Never. Don't even say 0.1. Because if I see it in your urine, officially you're diabetic. There's no argument about that. Why? Because the kidneys would be able to actually control the sugar up to, look how much it can control. It can control it up to 180. You guys know when we do blood sugar tests, and you know the fasting will be between 70, 60 to 100.
110.
Yeah, 110 maximum. But look at the kidney. Kidney can actually help you control the spill of that sugar up to 180. You go and eat, you know that your blood sugar gonna go up, correct? But you're not gonna find it in your urine because the kidney has something called threshold. So this is, we call it renal threshold. That's the maximum the kidney can tolerate. But if you are diabetic and you don't form enough insulin, and I send you to your break and you ate, and the sugar now starts going up after maybe 3-4 hours and still above 180, kidney would say, this one, I cannot do anything about it. And now you start having sugar in the urine, and officially you are diabetic. So when understood how the kidney controls the glucose. Okay. Excretion, metabolic waste. Let's name the waste based on what we talked in the previous room. Who can give me one of the wastes that we talked about? Not ammonia, because ammonia changed into what? Urea. So right, the first one, urea. Now don't forget excess what? We said excess water. That's a waste. If you have excess water, that's a waste, because overhydration can mess up everything. So excess water. Who can name another waste? You guys took in part 1 muscle contraction. What's the waste of the muscle contraction?
Lactic acid.
Lactic acid can be used, by the way, by the heart.
Oh.
Just to let you know. But I need something waste that we cannot keep it, because if you keep it, you have a problem with your kidneys. That's what I mean by waste. Which one? That's if you have infection, it's a different story. Blood in the urine, it's a different story. I'm asking about on a regular, daily basis. When we contract the muscles, guys. Anyone heard about creatinine?
Yeah.
Creatinine. You have to get rid of this, guys, through the kidneys. And the maximum you can have in your blood, because you have now in your blood creatinine. Then look at the maximum, even not 1, 0.8 gram per deciliter. You shouldn't have more than that in your blood. Sometimes 0.9 we say it's okay, especially if you have, severe muscular exercise at that day. It's not going to be an issue. But We like it below 1 when you do your creatinine in the blood. Above that, the kidney is not getting rid of it, is not expelling it. That means you have renal problem, you have kidney problem, and we have to search for it. In this case, to evaluate your kidney, we do something in the blood called
BUN.
BUN, because I said we have some urea in the blood and you have some in the urine. We call it blood, urea, and nitrogen. This is all plus creatinine, don't forget, plus number 3. Those are what we rely on to evaluate your kidneys. Any doctor who expects anything in the kidney has to send you for the lab to do BUN and creatinine. And if those are high, they officially gonna tell you, you have something wrong with your kidneys. And we wanna follow up with further testing. Also, don't forget that metabolic waste gonna end up in the kidney. Hormones, when we metabolize them, they end up in the urine. Processing of the alcohol, also same thing. It has to go to the liver, and then everything will become metabolic waste, has to end up in your urine. Renal anatomy, that's with the transverse section. At level of L2, lumbar 2, they have actually, here is the body of number 2, that's the posterior, this is the anterior. So they cut it even through, if you see here, the pancreas, the stomach, and you can see the kidneys. And I said, the kidneys are behind the peritoneum, the retroperitoneal structure. That's why when we dissect the fetal pig, you're gonna see them at the end, you see? How they lay, that's a vertebra, you're gonna see 1 and 2 here, and peel the peritoneum, and you see them underneath. A lot of students didn't see them. Where are the kidneys? I told them, they're hidden under that membrane. Peel the membrane and see the kidneys. So what you're peeling is the peritoneum. Okay? Here is the renal hilum, which is the belly button of the kidney. It has 3 structures. Same when we talked about the liver, porta hepatis. Now the kidney, it has 3 structures: renal artery, renal vein, and renal pelvis. And you can see them here lined up next to each other. So make
So it's
sure
the yellow thing
the yellow,
pelvis?
yeah, the beginning of the ureter out, when it starts out of the kidney,
Yeah.
we don't call it ureter, we call it renal pelvis. So if I point here or inside the kidney, because when we dissect it, you're gonna see the remaining part of it. Also, you say renal pelvis, but I have to dissect it to show it to you. And then after that, if I point here, you say ureter. So that's the difference between ureter and renal pelvis. So renal pelvis, okay, ureter. And here renal pelvis also, but I have to dissect the kidney and open. We're gonna see it. And I have kidney dissected here, the big size and small size. So make sure to look at those.
So the artery,
Uh,
and then vein, then ureter.
We wanna, so you call it hilum, belly button of the kidney, or hilus. Whatever you call it is fine. So either UM or US, hilum or hilus. There is a fascial connective tissue surrounding it for protection. And adipose, of course, like we saw it in front of the heart. You know, any soft organ has to have fat surrounding it. Even your eyes, if there is a pad of fat, line up all the orbit. Renal capsule, that's the one made of fibrous tissue. So protection for this soft organ, and we have to protect it with fibrous capsule. We're gonna dissect the kidney, and what we can do maybe next week, guys, make sure no open toe shoes, yeah, as we said, but we're gonna just do the kidney and urine. I'll let you do the urine with the dipstick method. Yeah, just It's not gonna take maybe,
Tuesday.
I would say 15, 20 minutes. It's just gonna open the kidney and study what's in it. So it's not gonna be a long, so by the end of the lab, maybe 1:30, 1:45, we can walk in and introduce you to the kidney, and we can do the dipstick method on your own urine. So your own urine gonna give you a sterile cup, you pee, come back, and then you dip the dipstick, and you'll be able to read it on the bottom. And hopefully none of you will have sugar, so glucose should be negative, assuming none of you diabetics. I don't wanna see bilirubin, because if I see bilirubin, that means it's what? You have problem with the liver. Yeah. Bilirubin shouldn't be in the urine, as we said, shouldn't be in the stool. You have stercobilin and you have urobilin. Yeah.
So we're doing the pee thing on Tuesday too?
On Tuesday.
Oh.
On Tuesday, we
And
can
the
do the two
dissection.
experiments. I'm done with the renal, and the last meeting, I leave it before the final, so you can dissect the whole fetal pig, because it will be near the final, so you won't forget all organs. Not exactly, maybe 2 weeks before final. Yeah, average. And you can keep your fetal pig in the fridge. Yeah, we have Ziploc bags. Yeah, write your name, keep it in the fridge. If you like any time to review, I can let you walk to the lab. Your classmate, you wanna share that, that's fine. And if we have male, female, I would like to keep the best two. I can keep them in the fridge, because reproductive system, you have to know the difference. So renal columns, you guys didn't dissect muscular in part 1, fetal pig muscles?
No, we don't.
Okay, but at least the organs, I would say systems are, muscles on a human is fine, yeah. But we're gonna emphasize on systems. That's the dissection that you're gonna see next Tuesday. This is what you're gonna see. That's not microscope, guys. When you open it, when you do this section, follow me here. So that's gonna save us time even on next Tuesday, because we're gonna go over it. The first thing, you see that thin line? That's the capsule. Feel free with the forceps just to peel, part of it, just to see how it's fibrous capsule. Then, you're gonna see cortex, see? Lighter color. Then triangles like this, with the base facing the cortex. So those are the medullary pyramids. We call them medullary pyramids. So now I'm in the medulla, because those are medullary pyramids. So what is in the cortex? What is in the medulla? Both of them, they have what? Nephrons. Those are the filtering units of the kidneys. Now, are you gonna see them here? If I ask you to dissect this and tell me where is the nephron, are you gonna see them? No, we're gonna see them in a kidney slide. And you guys saw it? Not yet? Bring it for you today. I'll bring it for you today, since it's renal. After you come from the break, I can just bring you the kidney slide. Yeah. So if you do a section in the kidney, you're gonna see nephrons here and nephrons here. Okay. And of course, nephrons having tubules, so you're also gonna see the tubules when you cut through them. Okay. So nephrons in the cortex, about 85% of your nephrons are in the cortex. Imagine. And we have millions in each kidney. So 85% of the count concentrated in the cortex. And we call them cortical nephrons. 15% of the nephrons are in the medulla. And we're gonna call them juxtamedullary nephrons. That's what they named them. Just put juxta. Juxtamedullary nephrons.
So that diagram when it says renal medulla and then the other part that says renal pyramid, it's the same thing, right? They're just showing these are two different names.
Yeah, I'm gonna tell you the difference here. If on the final you put on the triangle renal pyramid, I accept it. If you put medullary pyramid, I also accept it. It's just two different names. Yeah. So you put medullary pyramid or you put renal pyramid on the triangle, it's fine. The base facing the cortex and the apex towards the end of the medulla, opening in duct, as you see it here. It has a duct, you can't see it actually, it's a papillary duct. That's an opening here in the apex, you see? We call it papillary duct. Why? Because the tip of the triangle is called papilla, okay? The tip of the triangle, the apex called papilla, and within it has a duct called papillary duct, because you want to drain from all the nephrons ducts and drain it into the papillary duct. Because when we want to bring them where? To those structures which I'm going to tell you. Yeah.
The
Papillary duct.
slide after this one has
Details?
has all of them more detailed.
Yeah, the same thing. This is the same slide. But I want you to understand first that this cortex has 85% of your nephrons. So the cortex is very important. And then 15% of nephrons are in the medulla. Medulla has a medullary pyramids or renal pyramids. They have a base towards the cortex and apex, which we call it papilla. And the papilla within it, which we're not seeing it here, having a duct called papillary duct. Let's go here and show you how the filtering of urine from cortex, then to the medulla, then it enters papillary duct to minor calyx. You see that Y shape, follow me with the Y shape. 1 and 2 and big one here, correct? That's like a Y. So this, we call it minor calyx, major calyx. Make sure when I point to those on the models. Today, I think you can, see the slide quick after your break and then hold those kidney models and point to those structures. If you need help, just bring it and I can help you with that. So here is minor calyx, major calyx. You see, major calyx. So if I go now, if I point in the center, what you're gonna say? Remember, we talked about it. And it continue all the way here. Even here, you say renal pelvis. But when I point on this structure, ureter, because ureter is continuation of renal pelvis. Just continuation. Continue. Okay. So when we filter, it has to go all the way from the last duct, which we call it collecting duct. Can you see a structure of a snake here from the back? Or maybe the light is shining.
On my computer better.
Yeah. Maybe if you follow me with your computer, you can see it. Oh, maybe is this? No, that's better. Okay. Can you see now? Kind of like a structure like snake. This is the head of the snake. That's the tail. The last part of the tail called collecting duct, but I'm going to show you all the ducts and name them for you. The collecting duct, you can see it here, it drains all the way into minor calyx. You see here? So if I bring you a theory question, after the filtrate leaves papillary duct, which of the following structures it enters? What you gonna write? Minor calyx. So you pick minor calyx from the choices. Okay. Now, if I bring you a question, after the filtrate leaves collecting duct, which of the following structures it enters?
Papillary duct.
After, yes, after the, yes, so papillary duct is the answer. All right, papillary duct is the answer. So you have to know the direction of the filtration. The filtrate, how it goes and end up in your pelvis, and then ureter, then urinary bladder, then urethra, then you void it out, which we call it what? Urination. What's the other name? Voiding of urine. What's the third name? All of those mean the same. Micturition. Okay, so write them down. All of them, those mean. So you say voiding of urine. Same thing. Urination. Same thing. Micturition. Same thing. All right. All of those the same. And that's through urethral orifice, we call it. Urethral orifice. Opening. Blood supply and nerve supply. 7 more minutes and then we can dismiss you after that. Just focus, we're still in the introduction as you see here. Kidney receive about 20 to 25% of the cardiac output. How much the cardiac output we calculated before when we multiply stroke volume by heart rate? Who remember? Around 5 liters, correct. Remember 72 multiplied by 70 stroke volume? 70 cc per minute, per beat, and we multiply it by heart rate, which is 72. We end up with 5,000 cc, which is 5 liters. And I did the math for you. So 25% going to where? Kidneys. Your kidneys receive 25% of that amount of blood, of the cardiac output. Nerve supply. We know sympathetic versus parasympathetic. Sympathetic system relaxes the bladder wall, and you're gonna have less also filtration. So we're gonna store the urine that is already in the bladder. We're not contracting the bladder. We're talking about sympathetic, the fight or flight. So I repeat again, the bladder wall relaxes, stores more urine. You're not evacuating it, okay? And the blood vessels start to constrict, so you have less filtration. That happened in sympathetic nervous system stimulation. Now what happened to the para? We know para is feed and breathe. So what's gonna happen? That's a relaxation, feed and breathe. So what's gonna happen here?
Blood vessel.
Without any problem. So the wall of the bladder contracts, and what happened to the filtration also increases because the blood vessels are relaxing. You bring more blood. You see the difference between the two systems. And all of this happened because of the nerve supply. So nerve supply is important here. And here you can see the cortex, which is this one. They showed you one of the cortical nephrons. You can see it has a long loop of Henle, because it has to reach all the way down. And you can see the head of the snake is called, so today we're going to show it to you. We come back, I'm going to show you the head of the snake called the renal corpuscle. And follow the laser here. Of course, you're going to see them fragmented because when we do cut section, we cut through tubules, we cut through the neck of the head. So you're going to see the corpuscle separated than the tubules, or away from the tubules. So you're going to see this circle, guys. Even you can see it complete circle. Now, this C-shaped structure here that you see here, it's an empty space. It's not empty, it has the filtrate actually that will be absorbed or filtered from where? From the blood, from the capillaries. So all of those are capillaries, but the capillaries has a name. So the name is glomerulus. All right, so the glomerulus and this one called Bowman's capsule. You see, it's a C. Remember, C, capsule, Bowman's capsule. So glomerulus and Bowman's capsule, what we gonna call them together? The word, I said it at the beginning, just right now. Renal
Yeah, renal
corpuscle,
corpuscle.
correct. So renal corpuscle equal what? G glomerulus plus BC, correct? Bowman's capsule. The whole thing here called renal corpuscle. If I ask you what it consists of, you tell me, oh, the C and what's inside the C. The C is what? Bowman's capsule. And what's inside it? Glomerulus, the capillaries. Then the rest will be the tubules. Follow me with the tubules because they have names. Okay. This one, because it's closer to the renal corpuscle, we're going to use the term proximal. So this is proximal convoluted tubule. What is convoluted?
Combined.
No,
All over the place.
folded.
Oh,
Just folded. Oh, this one folded, this is not, correct? So we're gonna use the same term, which is convoluted, for the two at the edges. Okay. Proximal convoluted tubule, loop of Henle, the guy called Henle. So we honored his name, okay? If you call it nephron loop, it's fine. It's also accepted. Nephron loop, loop of Henle, I accept either one. Then distal, you see, because that's proximal. Distal convoluted. Why convoluted? It's folded again. And then the last one is collecting duct, which I showed it to you, opens where? You answered it before, opens where?
In the
Papillary duct.
papillary.
So this one, if I track it, look, it opened in the papillary. You see the triangle, guys? You see the apex? You see the base? You see the papillary duct, how it opened in the papillary duct? So we drained everything. Now it reached the apex of the triangle. Then after papillary duct, where it gonna enter after that? I know it's not in here.
It goes to
Minor calyx. Then from minor calyx into major calyx, and from major calyx into where? Renal pelvis. All major calyces will end up in renal pelvis. See, we have a major, major, major. All of those end up in renal pelvis, then to the ureter, urinary bladder, urethra, and you void it out. So we understood how we make urine, how we filtrate the blood into urine. If you want to keep those nephrons in good shape, watch the water that you drink. Okay? Because in some countries they rely, especially in India, they rely on wells. And wells, they have what? What we have? We have metals in the soil. So arsenic, a lot of heavy metals that can go in. And we found a lot on hemodialysis because of the water that they drink. So that's why drinking from tap water, you risk yourself here. Because, yes, they always tell us it's clean. I sometimes don't trust them because what happened in San Isidro school, if you remember.
Just recently?
Yeah, about
Yeah.
months ago, they
Yeah,
talked about it on the news. So in San Isidro, they said it was contaminated.
It's E. coli, right? Was it E. coli?
No, it wasn't E. coli, it was heavy metals.
Oh.
Yeah, I forgot what kind of metal they found, but imagine how many times those kids drank from the fountains. Also, there is a website. I know all of you buy water from outside, correct? From Costco, from anywhere. There is a website, you can verify the water that you drink. So, yeah, you know. So just type, the type, if you, Costco, I verified it was good. But if you buy another brand, you can go and Google it and find out if it's 5 stars, 4 stars, 3 stars, just to make sure that what you're buying is okay. Yeah.
Yeah, there's an actual website you can go on and put in like your city
Mhm.
and it tells you in all the contaminants. in the
All the
water.
contaminants in the water. Okay.
What
That's
about when
another
you're
thing.
filtering it, like I have a.
You have a filter, you have to
Filter.
change it once a
Yeah,
while.
you're fine.
Yeah, be careful with that.
Pangenol.
Yeah.
One like this out.
I'm not
Pangen.
talking about, you know, or criticizing filters, don't understand it this way, but at least Google what you are buying and see if it's effective. All right, so that's about the water. Also, be careful with the smoking, guys, because it constricts the blood vessels, nicotine. Alcohol also can affect the kidneys. Look how many things we talk about the alcohol. It also anything dehydration, avoid dehydration, of course, because having water every day is good for us. Flushing, you know, the system, especially when you wake up, guys. Look how many hours